The Biden administration is working to ease concerns over the new Omicron COVID-19 variant. The CDC is looking into tightening travel restrictions by adding more testing and screening for all travelers coming into the U.S. While no final decisions have been made, the CDC could soon require everyone coming into the country, regardless of their vaccination status, to show a negative COVID test taken within 24 hours of travel. Meanwhile, the focus remains on the effectiveness of the vaccines. Dr. Anthony Fauci promoted them Tuesday. He said that while it's possible the vaccine isn't as effective against the new COVID strain, the vaccines still likely prevent severe disease. President Biden plans to speak tomorrow about an updated strategy in tackling the pandemic. For more on this, I want to bring in Dr. Celine Gounder. She's an infectious disease specialist and epidemiologist at NYU Bellevue Hospital. She was also a member of the Biden-Harris Transition COVID-19 Advisory Board. Welcome, Celine. Great to have you with us. So, as I mentioned, the Biden administration is considering requiring all travelers, vaccinated and unvaccinated, to be tested within 24 hours before they come into the U.S. Since opening up international travel, the rule has been to show a negative test taken within 72 hours. So how much does changing the time frame, moving it up, a day, how much does that actually affect things?
This is a really important move, and frankly, one that should have been taken back in the spring with the emergence of the Delta variant. The issue here is if you have a virus that has a very short incubation period and you get tested 72 hours prior to flying, you could still be incubating that virus and actually be positive at the time that you're boarding the flight. We really want to know at the time that you're boarding, are you infectious to other people? And so I think shortening that window for testing prior to flying is really important.
And Dr. Gounder, there is still some uncertainty over how much vaccines protect us against this new variant. Dr. Fauci and the Israeli health minister have both expressed confidence that the vaccine will still give people a certain level of protection. But it seems as these new variants come about, the level of protection from the vaccine appears to be diminishing. Is that due to the time frame? Simply it loses effectiveness over time? Or is that due to something else? And what does this mean going forward?
This is not really a question of waning immunity. This is really a question of how is the virus mutating and how new variants emerge. And there are three main ways in which variants can be different from one another: how infectious or transmissible they are, how easily they spread from one person to another. Secondly, how effective are the current vaccines? How effective is immunity from a prior infection in terms of protecting you? And we do think that Omicron may have some relative immune evasion, in which case prior infection is unlikely to provide much protection, and the vaccines may be less effective, but still prevent severe disease. Mm-hmm. And then finally, variants can also be different in terms of the severity of disease that they cause.
So what is the latest that we are hearing on the, Omicron variant? It seems to not be producing severe levels of illness. Is that correct? Or is that only in cases of breakthrough infection?
Yeah, I would really be careful about reading into that preliminary data. What we've seen with Omicron is a lot of those cases in South Africa, for example, that Portuguese soccer team where a number of players were infected. These are young, healthy people. And we know that with COVID in general, it causes less severe disease in young, healthy people than it does in older people. And so we really need to wait and see how this plays out through a broader proportion of the population, through different age groups, before jumping to that conclusion.
And is it true we should have a little bit more insight in about 2 weeks or so? Is that the time frame that doctors are looking at?
That's right. So over the next 2 weeks, laboratory scientists are going to be looking at how effective both immunity from natural infection as well as immunity from vaccination, how well those hold up against the Omicron variant. So that's one of the three characteristics of viruses that we really worry about here. And we should have an answer to that question of immune evasion ahead of the other questions.
An answer a lot of people are waiting for with bated breath. All right. Now, Doctor, on Tuesday, the FDA advisory panel also voted to recommend emergency use authorization of the Merck antiviral pill. If the FDA authorizes it, do we have any idea yet how effective it will be against fighting this new variant?
Well, it's highly unlikely that its effectiveness would change versus Omicron as opposed to prior variants. The mechanism of action is independent of the spike protein, and where we're seeing a lot of these mutations with Omicron are in that spike protein. But that said, the Merck drug molnupiravir is not that effective. It's only showing about 30% effectiveness, and there are some real concerns about the possibility for congenital birth defects if women were to take this during pregnancy, and some other risks, possibly around risk for cancer. And so many of us who are infectious disease specialists and others are very hesitant to jump on using this drug, even if there is an emergency use authorization.
All right. Well, Dr. Celine Gounder, thank you so much for joining us. We appreciate your insight.